بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. آمين يا رب العالمين. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is about presenting 10 cases of chest X-ray, and I hope try to test yourself before I giving the answer to these chest X-rays. The first case, try to look at it and try to find what is the pathology. 10 seconds given to you to answer this. Okay, it is an easy chest X-ray. As we see here, there are bilateral cervical ribs. The right one is larger than the left one, and it is asymmetric. And the rest of the chest X-ray is normal. What is cervical rib? Cervical rib are supernumerary or accessory ribs arising from the 7 cervical vertebra, and it is common in female and usually bilateral and asymmetrical, and it is present in about 0.5% of population. Usually the cervical ribs are asymptomatic, and it is common, as we see, it is the most important anatomic rib variant and can cause thoracic outlet syndrome by compressing the brachial plexus or subclavian vessels. So this is a classic case of bilateral cervical ribs, more to the right side, asymmetric and more to the right side. The second case, look at it and try to answer what is in this case. As we see here, this is chest X-ray of female patient. The right breast is present, the left breast is absent, and we have surgical eclipse in the left axilla. Okay, what else? We have also the multiple nodular shadows involving both lungs, and the right hilum is enlarged, likely due to lymph node. So this is mastectomy, left mastectomy in this patient with multiple nodular shadow representing metastasis. So this is a classic case of metastasis from the left breast cancer following mastectomy. Here, another case. Look at it and try to find what is the pathology. Okay, Try to look at the left humerus. We see there is a fracture in the left humerus and with some angulation, and the rest of the chest it is normal. So this is normal chest X-ray with a fracture of left humeral neck. Next case, try to look at it and try to find the pathology. Here, chest X-ray, what is striking to you? Where is the cardiac border on the right side? What is the orientation of the ribs? These are clues to you. So this is what we call this the pathology. It is a pectus excavatum. As we see here, the right cardiac border is not seen, and also the heart is relatively shifted to the left side, and also the orientation of the ribs are vertical in orientation. And this is due to depressed sternum. One of the differential diagnoses is right middle lobe collapse or consolidation. So this is a classic case of pectus excavatum or funnel chest. It is a congenital anomaly of chest wall characterized by depression of the sternum. And what is the opposite of this deformity? What we call it? We call it pectus carnatum or pigeon chest. This abnormality is common in males and the ratio about 3:1. So this is a classic case of pectus excavatum. Here another case. What you see, try to find the abnormality. Here we see the heart shadow here, and there is an obesity in the retrocardiac obesity involving obliterating the descending aorta, also obliterating the medial portion of the left hemidiaphragm or silhouetting of the medial portion and the descending aorta. And that line also, this is the margin of the oblique fissure displaced due to collapse. So this is a classic case of left lower lobe collapse, obliterating the medial portion of the left hemidiaphragm and the descending aorta and medial displacement of the oblique fissure. Here, this is another case, and this classic case, and you should not miss it in your life, and it is should be keep in looking at it. And this is a classic case of left-sided pneumothorax. Here, this is another case of, as we see here, the heart silhouette is enlarged with tortuous aorta, but what we don't want this finding. We looking for another finding. You see the air fluid level in the retrocardiac area. This is an hiatus hernia with air fluid level. What is hiatus hernia? Hiatus hernia is herniation of the abdominal content through the esophageal hiatus of the diaphragm into thoracic cavity, and it is common and increases with age, and it is common in female patient. As we see here, this is a female patient and this is the birth shadow. The lungs are clear and this patient might present with aspiration pneumonia or other clinical conditions. Here what we see complete opacification of the right hemithorax and the heart is shifted to the left side and the trachea also shifted to the left side, and so this is a large amount of right-sided pleural effusion causing mediastinal shift. The differential diagnosis of this or of this opacification of the right hemithorax is collapse, complete collapse of the right lung, and we see the heart will be shifted to the same side and the trachea will be shifted to the same side of the collapse. Other differential diagnosis will we have pulmonary infection involving the whole lung. There is no shifting of the mediastinal structure, and also another differential diagnosis we have a pneumonectomy, and we see the surgical intervention with the ribs or clips in the involving or missing of the ribs involving the site of the pneumonectomy. Here, this is our last case. As we see here, this is normal chest X-ray, and we see here of the diaphragm, and we see here part of the diaphragm has abnormal contour, and this is elevation affect part of the diaphragm or segment of the diaphragm. We call this diaphragmatic hump or diaphragmatic eventration, and it is different from the diaphragmatic paralysis, which affect the whole part of the diaphragm. And this is congenital in nature and due to incomplete muscularization of the diaphragm with a thin membranous sheet replacing the normal diaphragmatic muscle. Over time, this stretches and on inspiration does not contract normally and usually affect the anterior medial portion of the right hemidiaphragm. Thank you very much for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.